Have you ever walked out of a doctor's office feeling confused, unheard, or worse, misdiagnosed? You trusted the white coat. You answered honestly. And yet, your health declined. Here's a truth most seniors never realize until it's too late. What you say at a doctor's office can quietly shape your diagnosis, your treatment, and sometimes your future. A 67-year-old man once told his doctor, "Oh, it's nothing serious, just age." 6 months later, that "nothing serious" became irreversible. A 72-year-old woman smiled and said, "I don't want to trouble you, doctor." Her silence cost her years of quality life. This video is not about blaming doctors. It's about protecting yourself. Because many seniors, good, polite, respectful people, unknowingly say the wrong things, minimize their pain, exaggerate others, or speak in ways that cause doctors to miss the real problem. And once a medical record is written, it follows you. Today's video topic is, never speak like this at a doctor's office. Many seniors make these dangerous mistakes. If this video saves even one person from a wrong diagnosis, unnecessary medication, or silent suffering, like this video, subscribe to the channel, and share it with someone you love. Because wisdom isn't just about living longer, it's about speaking smarter when it matters most. Now listen carefully. Number 1. It's probably just old age. It's probably just old age. Those 6 words sound harmless, responsible even, but they have quietly erased more real diagnoses than fear, ignorance, or even negligence ever could. Every day, seniors walk into a doctor's office carrying something heavy: pain in their joints, a strange pressure in the chest, a fog in their mind that wasn't there before. And before the doctor even asks the right question, the patient answers it for them. Not with truth, but with surrender. They minimize, they excuse, they shrink their own suffering to fit a story they've been told their entire lives. Aging means decline. But here is the uncomfortable truth. No one tells you clearly enough. Pain is not a requirement of getting older. Extreme fatigue is not a badge of age. And memory loss is not a sentence you automatically sign after 60. Yet the moment you say, "It's probably just old age," something dangerous happens. The investigation stops. The urgency fades. The deeper questions are never asked. Not because doctors don't care, but because medicine listens closely to language. And your words become the frame through which everything else is interpreted. There was a 68-year-old man who mentioned mild chest discomfort. He smiled. He waved it off. "Probably just age," he said. He didn't want to seem dramatic. He didn't want to take up time. Months later, that age was advanced heart disease missed. Not because it wasn't there, but because it was never allowed to speak loudly enough. There was a woman in her early 70s who kept forgetting names, not just occasionally, but entire conversations. She laughed about it. You know how it is at my age. That laughter delayed a diagnosis that could have slowed cognitive decline if caught earlier. What she thought was humility was actually self-erasure. And this is the most heartbreaking part. Many seniors say this not because they believe it, but because they've been taught to endure silently, to be grateful, to not complain, to accept less care as the price of more years. Somewhere along the way, strength got confused with suffering. But medicine does not work on assumptions. It works on signals. When you label a symptom as age, you strip it of its urgency. You tell the doctor, "This doesn't need attention." And once it's written into your medical record, it becomes harder and harder to challenge later. Every future visit is filtered through that first dismissal. Age explains the number of years you've lived. It does not explain sudden pain. It does not explain rapid fatigue. It does not explain changes that alter your daily life. Aging is gradual. Disease is often not. And the body is not cruel without reason. When it sends pain, weakness, confusion, or discomfort, it is asking to be heard, not explained away. So if you are a senior listening to this, hear this clearly and without sugarcoating. You do not earn pain by living longer. You do not lose the right to care because of your birth year. And you do not help your doctor by excusing your symptoms. You help them by describing them honestly and fully. The most dangerous thing about that sentence, "It's probably just old age," is not what it says. It's what it prevents. Because many people didn't die from age. They died from silence. Number 2. I don't want to be a burden. It sounds gentle, considerate, almost noble, but inside a doctor's office, those words can quietly sabotage your own survival. This sentence is rarely spoken by selfish people. It's spoken by the most caring ones, by seniors who spent their lives providing, sacrificing, holding families together, people who learned early that complaining was weakness and that taking up space meant taking from others. So even when their body is clearly asking for help, they soften the truth out of kindness. And that is exactly why it's so dangerous. Doctors don't diagnose kindness. They diagnose information. Medicine does not work on hints, smiles, or apologies. It works on clear, direct descriptions of what hurts, how long it has hurt, and how deeply it is affecting your life. When you say, "I don't want to be a burden," what you're really saying is, "Please don't look too closely." There was a 74-year-old woman who came in with persistent shortness of breath. She spoke softly. She apologized before every sentence. "It's probably nothing. I don't want to take your time." She left with reassurance instead of answers. Weeks later, she returned by ambulance. Her lungs had been struggling long before her words allowed them to be heard. This is the brutal irony. Symptoms do not disappear when you downplay them. They don't get offended and leave. They don't respect politeness. They hide. They deepen. They return louder often when it's harder to fix them. Many seniors believe that enduring pain quietly is a form of dignity. But dignity is not silence. Dignity is advocating for the life you've already earned. And the longer you delay care out of fear of being a burden, the heavier the burden eventually becomes, not just for you, but for your family, your caregivers, and the very doctors you were trying not to trouble. There was a man in his late 60s who ignored increasing weakness in his legs. He didn't want extra tests, didn't want follow-ups. "Others have it worse," he kept saying. By the time he couldn't walk without help, the condition that could have been slowed was already advanced. His attempt to stay invisible made his suffering impossible to ignore later. Here's the truth that needs to be said clearly. Without softness, doctors are not burdened by patients. They are burdened by missing information. You are not wasting time by telling the full story. You are saving time by preventing emergencies. A 10-minute honest conversation can prevent a lifetime of regret. And listen carefully, your health is not a favor you ask for. It is not a debt. It is not something you must earn by being easy, agreeable, or quiet. You have already paid for it with decades of living. When you step into a doctor's office, that is not the place for self-sacrifice. That is the place for truth. Raw, uncomfortable, unfiltered truth. Because the body doesn't heal on politeness. It heals on clarity. So if you feel the urge to say, "I don't want to be a burden," pause. Replace it with this instead. "This is affecting my daily life. This worries me. This feels different than before." Those words don't make you difficult. They make you visible. And visibility, in medicine, can be the difference between early care and irreversible damage. Kindness kept you alive in life. But in that room, clarity will save you. Number 3. I Googled it, so I think I know what it is. The moment these words leave your mouth, the air in the room changes. Not loudly, not obviously, but unmistakably. You may not notice it, but the dynamic shifts. The doctor's posture tightens. The conversation subtly narrows. Some doctors withdraw. Others become guarded. A few feel challenged. And in that quiet shift, something critical is lost. Openness. This sentence rarely comes from ego. It comes from anxiety, from nights spent awake, scrolling through symptoms, searching for reassurance or preparation. Seniors often say it because they don't want to be ignorant. They want to show they care about their health. They want to regain a sense of control in a world where the body suddenly feels unpredictable. But medicine doesn't respond well to conclusions. It responds to curiosity. When you lead with what you think it is, the conversation becomes about confirming or disproving your theory, instead of exploring all possibilities. And doctors, being human, may unconsciously focus on correcting you rather than investigating you. The appointment becomes a debate instead of a discovery. There was a man in his early 70s who came in with stomach pain and weight loss. He confidently announced, "I think it's just acid reflux, I read about it." The doctor treated what was presented. The deeper issue, something far more serious, went unnoticed until symptoms could no longer be ignored. His certainty didn't protect him. It delayed him. Another woman arrived worried about dizziness and headaches. She told the doctor she had researched it thoroughly and believed it was stress. The doctor accepted the framing. Months later, tests revealed something that should have been caught earlier. What began as reassurance became regret. Here's the hard truth most people never hear. Doctors are trained to listen for patterns, not theories. They listen to how symptoms started, how they changed, what makes them better or worse, what they interrupt in your daily life. When you replace observations with diagnoses, you blur the very signals they need to help you. What you feel is evidence. What you read is context, but context is not conclusion. And there's another quiet danger here, especially for seniors. When you name a diagnosis yourself, it gets written down. It becomes an anchor. Every future symptom is interpreted through that label. And once a narrative is set, it takes something extreme to undo it. The body is complex. Symptoms overlap. One condition can imitate another perfectly. That's why doctors spend years learning to rule out, not just rule in. So instead of saying, "I Googled it and I think it's this," say this instead: "I've been feeling this pain for 3 weeks. It wakes me at night. It's different from anything I've felt before. It's affecting how I walk, sleep, or think." Those words don't challenge a doctor. They guide one. Because the truth is, your job is not to diagnose yourself. Your job is to tell your story clearly. The internet can give you information, but only a real conversation can give you care. And the most dangerous part of that sentence isn't that it's wrong. It's that it feels right and quietly closes doors you didn't even know existed. Number 4, everything is fine when it isn't. It's often said with a smile, a small shrug, a calm tone meant to reassure. But inside a doctor's office, those words can be more dangerous than pain itself. Many seniors have mastered the art of smiling through discomfort. They learned it young, when complaining was discouraged, when strength meant endurance, when showing pain meant being seen as weak or dramatic. Over time, that habit hardens into identity. Even when the body is clearly struggling, the mouth says, "I'm okay." And doctors, again, are human. They hear the words, they see the smile, they trust the presentation. What they don't see is what happens when the door closes. There was a man in his late 60s who came in for routine checkups. Every time he was asked how he felt, he answered the same way: "Fine." What he didn't mention was the pain that woke him at night, the shortness of breath he hid during walks, the dizziness he blamed on standing up too fast. By the time he collapsed at home, the warning signs had been present for years, muted by pride and fear. Another woman, well into her 70s, had been living with constant joint pain and exhaustion. She told herself it was normal, told her doctor she was managing. What she didn't say was that she had stopped leaving the house, stopped meeting friends, stopped enjoying the life she worked decades to build. Her silence didn't make her strong, it made her invisible. Why do so many seniors do this? Because they were taught to be resilient. Because hospitals remind them of loss. Because bad news feels heavier at an older age. Because admitting pain feels like admitting decline. So they protect themselves with silence. But silence doesn't protect you from illness. It protects illness from being seen. Doctors are not mind readers. They don't diagnose based on posture or politeness. They diagnose based on what you say, and what you don't say is just as powerful. When you hide symptoms, you remove urgency. You delay tests. You postpone action. And in medicine, time is not neutral. Time can turn manageable problems into permanent ones. There is a cruel misunderstanding here. Many seniors believe that if they don't speak about pain, they won't have to face it. But pain that isn't acknowledged doesn't fade. It organizes. It adapts. It waits. The body is not dramatic without reason. It doesn't send signals to annoy you. It sends them because something needs attention. And when you deny those signals with "everything is fine," you are not being brave. You are being unheard. Here is the truth that deserves to be said without comfort. Doctors cannot treat what you hide. They cannot protect you from what they don't know. And they cannot help the version of you that pretends everything is okay. Strength is not silence. Strength is honesty even when it's uncomfortable. If something hurts, say it. If something changed, say it. If something feels wrong, say it. Because healing begins the moment truth is spoken. And the most dangerous lie you can tell in a doctor's office is not to them. It's to yourself. Number 5. I stopped taking the medicine. When said casually, this sentence can change everything. Not just the treatment, not just the next prescription, but the way your doctor sees you from that moment forward. And here's the tragedy. Most seniors don't stop medication out of recklessness. They stop because of fear, because of side effects no one warned them about, because the pills made them dizzy, nauseous, confused, or exhausted, because the cost was too high, because the instructions were overwhelming, because they didn't feel like themselves anymore. But when those reasons aren't spoken, the sentence stands alone and alone. It sounds dangerous. Doctors rely on trust the same way patients do. When you simply say, I stopped taking the medicine, without explanation, it triggers alarms. It raises doubts. It changes the tone of the relationship. The doctor may worry about compliance, about safety, about whether future instructions will be followed. And once that concern is planted, future care subtly shifts. This isn't punishment. It's human nature. There was a man in his early 70s who stopped his blood pressure medication because it made him feel weak and dizzy. He didn't want to seem difficult, so when asked, he just said, I stopped it. The doctor, lacking context, increased the dosage of a different drug later. The side effects worsened. The man lost confidence in medicine entirely not because he was careless, but because he never told the full story. Another woman stopped taking a prescribed pill because she couldn't afford to refill it every month. She felt embarrassed, ashamed. So she stayed silent. When the doctor discovered she had stopped, the assumption was non-adherence, not hardship. A simple conversation could have changed everything. Instead, her care became more rigid, less flexible, more distant. Here is what many people don't realize. Stopping medication is not the real danger. Stopping communication is. Doctors don't need perfection. They need honesty with context. Side effects are not failures. Fear is not weakness. Confusion is not incompetence. Financial strain is not irresponsibility. But when you hide the reason, the system fills in the blanks, and often it fills them incorrectly. Medication is powerful. It alters chemistry, rhythm, balance. For seniors especially, even small changes can feel overwhelming. Bodies change. Tolerance shifts. What worked once may not work now. This is normal, but only if it's discussed. When you provide context, something powerful happens. The doctor listens differently. Options appear. Dosages are adjusted. Alternatives are explored. Trust deepens instead of fractures. But when you don't, the relationship becomes cautious, guarded, less collaborative. And that caution can delay the care you actually need. So if you've ever stopped a medication or are thinking about it, remember this. Never confess without explaining. Never hide the reason. Never assume silence is safer than truth. Say instead, I stopped because it made me feel unwell. I was afraid of the side effects. I couldn't afford it. I didn't understand how to take it properly. Those words don't weaken your care. They strengthen it, because honesty with context doesn't just protect trust. It saves lives. Number 6. My friend had this, so I took the same medicine. It sounds practical, even smart. After all, the symptoms felt similar. The friend improved. The medicine was right there, familiar, trusted, recommended by experience instead of uncertainty. But inside medicine, this sentence sets off silent alarms. Because what feels like a shortcut to relief can become a direct road to the emergency room. Seniors often share medicines for the same reason they share advice: out of care, out of community, out of the belief that experience is wisdom. For decades, they have solved problems by talking to each other, helping each other, borrowing what worked. So when pain appears, it feels natural to lean on what helps someone else. But the human body is not a copy and paste system. Every body is different. Every chemistry is different. Every history is different. Two people can feel the same pain and have entirely different causes behind it. One medicine can heal one person and seriously harm another, especially in older bodies where reactions are stronger and interactions are unpredictable. There was a man in his 70s who borrowed his friend's heart medication because they both complained of chest discomfort. What he didn't know was that his friend's drug slowed heart rhythm, something safe for one condition but dangerous for another. Within hours, he was dizzy, confused, and collapsing. What he thought was help nearly stopped his heart. Another woman shared arthritis medication with a neighbor. The pain relief worked for a day. Then came stomach bleeding. What she didn't realize was that her body couldn't tolerate that drug due to an underlying condition she'd never been diagnosed with. The pain was temporary. The damage was not. And here's the deeper danger no one talks about. When you tell a doctor you took someone else's medicine, it doesn't just worry them, it redefines how they see risk. It signals unpredictable behavior. It forces them to be more cautious, more guarded, sometimes less flexible with treatment, not out of judgment, but out of fear for your safety. Medicine is built on precision, dosage, timing, interaction, history. When medicine is shared, all of that disappears. One pill can interact with another you're already taking. One tablet can strain kidneys already working harder with age. One capsule can trigger bleeding, confusion, or collapse. And because seniors often take multiple medications, the risk multiplies silently. The most tragic part? Many people don't tell their doctor right away. They feel embarrassed. They don't want to be scolded. So they hide it until symptoms spiral and the truth comes out in crisis. This is why shared medicine has sent countless seniors to emergency rooms. Not because they were careless, but because they trusted familiarity over safety. Experience feels convincing. But biology doesn't care about stories. A medicine that helped your friend was chosen based on their tests, their blood work, their diagnosis. Without those details, you are guessing with your health. And guessing is not treatment. So if you've ever thought about taking someone else's medicine, or already have, hear this clearly. There is no such thing as a harmless borrowed pill. There is no such thing as just trying it once. And there is no safety in similarity. Your body deserves its own answers. Your pain deserves its own investigation. Your life deserves its own care. Because one shared tablet can undo years of survival. And no relief is worth that price. Number 7. Just give me something strong. Those words often come after weeks, sometimes months, of unrelenting pain. After sleepless nights. After days when even simple movements feel like punishment. They're not spoken casually. They're spoken when patience is gone and hope is thinning. But the moment those words are said, something subtle and dangerous happens. A label forms, not because pain doesn't matter, but because language matters. To a doctor, especially in today's medical world, that sentence can mean many things at once. It can suggest urgency, but it can also suggest risk. Some doctors hear desperation, others hear pressure, and a few, shaped by policy and fear, hear a warning bell they cannot ignore. This is not fair, but it is real. There was a man in his late 60s who had lived with back pain for years. When he finally couldn't stand it anymore, he walked into the clinic and said exactly that, "Just give me something strong." The doctor didn't hear years of endurance. He heard a request that placed the conversation on edge. Instead of a full investigation, the visit became cautious, brief, distant. The man left with less help than he needed, not because his pain wasn't real, but because his words changed the room. Another woman with severe joint pain asked the same thing after trying every remedy she knew. What she needed was understanding, imaging, and a long-term plan. What she got was dismissal. Her suffering was real. Her phrasing worked against her. Pain relief absolutely matters. Pain is not weakness. It is a signal. And for seniors, pain is often layered: physical, emotional, historical. Years of labor, sacrifice, and injury accumulate. Wanting relief is human. But when you ask for strength, instead of describing experience, You shift the focus away from care and toward control. Doctors treat patterns, not demands. They respond to details, not intensity. When you describe the pain, where it starts, how it spreads, what it interrupts you, give the doctor something powerful to work with. You turn pain into information, and information opens doors that requests cannot. There is also a quiet danger here that rarely gets discussed. When a doctor perceives pressure, they may overcorrect. They may prescribe too cautiously or too aggressively. Either way, the balance is lost. And for seniors, that balance matters more than ever. Overmedication can cause confusion, falls, dependency, and damage that lasts longer than the pain itself. The tragedy is this: many seniors ask for something strong because they've already tried to be patient. They've already minimized. They've already endured. And when they finally speak with urgency, they are misunderstood. So here is the shift that saves you. Instead of saying, "Just give me something strong," say this: "This pain keeps me awake at night. I can't walk the way I used to. It's getting worse, not better. It's changing how I live." Those words don't trigger alarms. They trigger attention, because treatment should rise naturally from understanding, not from fear on either side of the table. Your pain deserves respect, but your words decide how that respect is delivered. And sometimes the strongest thing you can do is not ask for something strong, but speak with clarity, strong enough to be heard. Number 8. I forgot it's not important. These words are usually said quickly, with embarrassment, with a nervous smile meant to move the conversation along. But in a doctor's office, they can carry more danger than pain itself. Many seniors treat memory gaps like personal failures, something to hide, excuse, or laugh away. They don't want to seem confused. They don't want to worry their families. And they don't want to open doors they're afraid of walking through. So when a detail slips away, they minimize it. They decide for themselves that it doesn't matter. But medicine doesn't work on what feels important. It works on what is different. There was a man in his early 70s who kept forgetting small things, appointments, directions, the names of people he'd known for years. He brushed it off. "Just getting older," he said. What he didn't mention was the moment he stood up and felt the room spin, or the fall he didn't remember clearly, or the confusion that came and went like fog. Those weren't inconveniences, they were clues. And by the time they were finally spoken aloud, they had formed a pattern that could no longer be ignored. Another woman dismissed sudden changes in her thinking because she was afraid of what they might mean. She forgot words mid-sentence, lost track of time, felt strangely disoriented in familiar places. She told herself it wasn't important. But the body had been sending signals for months, signals that could have changed the course of her care if they had been named sooner. Here is the truth most people never hear clearly enough. Memory gaps are not random. They are messages. Dizziness matters. Falls matter. Sudden confusion matters. Moments that feel off matter more than you think. These are not signs of weakness. They are data points. Doctors don't just listen to what you remember, they listen to what you struggle to remember. What fades, what disappears, what changes suddenly. These are often the earliest indicators of something deeper. When you dismiss them, you erase the very trail that could lead to answers. And there is another painful layer here. Many seniors fear that admitting memory problems means losing independence, losing respect, losing control. So they choose silence instead. But silence doesn't protect independence, it endangers it. Early honesty creates options. Late honesty creates limitations. What you forget may be exactly what the doctor needs most. That fall, you can't explain. That moment of confusion you laughed off. That blank space in your memory that scared you for just a second. Those moments are not nothing. They are the body asking for attention. The mind is not supposed to fail quietly. When it does, it's rarely without cause. And the earlier that cause is explored, the more power you retain over what comes next. So if you ever catch yourself saying, "I forgot," "It's not important," stop. Say instead, "I don't remember this clearly. I've been feeling confused at times. Something about this feels different." Those words don't make you fragile. They make you informed, because forgetting is not the danger. Ignoring it is. Number 9. Do whatever you think is best. It sounds calm, trusting, even wise. Many seniors say it to show respect, to avoid conflict, to signal confidence in the doctor's expertise. After a lifetime of listening to authority, it feels natural to step back and let someone else decide. But inside a doctor's office, this sentence does something quietly dangerous. It removes you from your own care. Good doctors don't want obedience. They want partnership. Medicine is not a one-way command. It is a conversation. And when you step out of that conversation, crucial pieces disappear. Your priorities, your fears, your daily reality. The doctor is left making decisions without the most important context: your life. There was a man in his early 70s who always said this. He never asked questions, never challenged suggestions. When given multiple treatment options, he waved them away. "You know better than me." The doctor chose the medically standard route, but it ignored what mattered most to the man: quality of life. Months later, he regretted choices he never truly made. Not because the doctor was wrong, but because his own voice was missing. Another woman agreed to a treatment plan without understanding it. She trusted the system. She trusted the authority. What she didn't understand were the side effects, the alternatives, the long-term consequences. When complications arose, she felt betrayed not by the doctor, but by herself for not asking sooner. Here is the truth most seniors were never taught. Trust does not mean silence. Respect does not mean surrender. Doctors are trained in medicine, but you are the expert on your body, your tolerance, your fears, your goals. Only you know what you are willing to endure. Only you know what kind of life you want to protect. When you say, "Do whatever you think is best," you erase that expertise. Doctors make better decisions when patients speak, when they ask questions, when they express doubt, when they say, "I don't understand," or "That worries me," or "Is there another option?" Those moments don't slow care, they sharpen it. And here's the emotional truth many people don't realize until later. The treatments you regret most are often the ones you never questioned. Asking questions does not make you difficult. Understanding options does not make you distrustful. Participating in decisions does not make you disrespectful. It makes you alive in the process. Medicine works best when both sides are present, when expertise meets experience, when science meets reality, when the person being treated remains a person, not a passive body on a table. So, if you ever feel tempted to say, "Do whatever you think is best," pause. Replace it with this instead. What are my options? What happens if I wait? How will this affect my daily life? What would you recommend? And why? Those questions don't weaken trust. They deepen it, because your voice is not extra in this room. It is part of the treatment, and when you leave it behind, you leave power behind with it. As we conclude, doctors diagnose with tools, but they decide with words. And the words you choose can speed healing or silently delay it. If you are a senior or loved one, remember this. Speak clearly, speak fully, speak without fear, because your health deserves truth, not politeness. If this video helped you even a little, like, subscribe, comment. I will speak wisely, because life doesn't end with age. It ends with silence.